UN General Assembly, where we've had a great week for the Global Initiative to Support Parents and Parenting, and we're looking forward to sharing all of that with you. So welcome to everyone. Today, this is our tradition of monthly parenting town halls, where we can have a global conversation on parenting on different issues and themes. And today is a big day for us because we're launching so many different things. So Claire, if you can go to the next slide. So what to expect today? We have news and upcoming events. We'll have the launch of the Common Elements project that Dr. Aisha Yousafzai at Harvard is doing for the Global Initiative to Support Parents. A briefing on the upcoming Global Ministerial Conference to End Violence Against Children. We'll hear an example of parenting and storytelling, and then really exciting panel on the parenting magazine. So let's go next. Claire? Wonderful. So on Tuesday, with gratitude to the Doris Duke Foundation, we launched just before I go, Claire, can you just message Sabine? There are a few people that are having a hard time logging in. So if you can just message her, I think, yeah, just message her. All right. On Tuesday, we launched the parenting magazine of the Doris Duke Foundation. We had a really interesting conversation because the Royal Foundation had written a report on early childhood. So we had a conversation about the role of business in parenting. And it was a really compelling and powerful session because we had business with us. We had the Lego Group and the Royal Foundation and Deloitte, but we also had the government of Nigeria. We had civil society representatives, we had researchers, we had a parent, and it was a really successful moment. And it was the first time we launched the parenting magazine, which is also happening today, where we'll hear the panelists and we will share the link in the chat for everyone to join. Next slide, Claire. And also earlier this month, in collaboration with the Africa Early Childhood Network and all the Global Initiative to Support Parents, we have a compendium of African initiatives to support parents and caregivers. This is an effort that came out of the regional convenings that happened over the past 2 years as well. And we have a compendium that's coming out of Europe and Central Asia as well. So there's a lot happening, and my colleagues will share both those links in the chat. So that's, yes, the parents. So Claire will share both those. I'm loving the reaction. So really great, guys. We're slowly bringing the field together again. What's interesting and unique about the Global Initiative to Support Parents, for the first time, we're trying to build a platform to have parenting across the life course, across initiatives, across sectors, so that we elevate parenting from beyond scaling up single parent packages and to this broader effort. To that end, we really, really want everyone. So my colleague Claire is going to pop the survey link. We are in the process of designing the next phase of the partnership, and we want to hear from you. We want to hear where we've been effective and where we haven't, and how can we do better. So please, everyone, just take a minute, click on this link, have it in your browser. And by the end of this webinar, I'm hoping at least everybody on here will have completed the survey. Thank you, Carol. Carol has the survey in there. All right, let's go next, Claire. So today, it's really my pleasure to introduce to you Dr. Aisha Yousafzai at the Harvard Public Health School. And, you know, over the past couple years, we've been thinking about what is it that needs to happen in the field to really advance parenting. And one of the things is, you know, a lot of parenting packages are proprietary, they're behind cost. The way data is reported, we often don't understand what are the actual elements of parenting programs that are effective. So so in collaboration with Harvard and the Global Initiative to Support Parents, we've launched this big effort to really unpack that and understand that. And today we're going to hear from Aisha how we're going to do this, but hopefully this will be a benefit to all. The database will be on the GISP website, and we look forward to hearing about this and also engaging with all of you here today and your colleagues and experts. So I'm going to hand it over to Aisha. Aisha, over to you.
Thank you so much, Shakufe. I will just take a moment to share my screen. All right. Okay. So, first of all, it's always very, very exciting to be able to be part of these town halls. And it is my pleasure to be able to, with my colleague Janita Henry, introduce the Common Elements in Parenting Programs project. As Shakufe shared, this is in partnership with GISP. And really, this project is about identifying those ingredients in parenting curricula which drive program success. So in this brief overview, we will share the overview of the project. We will share the very early findings that we have from phase 1 of the project. And we'll also describe and invite you all to join us in this global effort. So to begin with, the overview of the project. All of us here who work in the parenting field understand that it's challenging, it's complex, and it's an incredibly diverse field. So we often find ourselves asking, why is it that some programs are more impactful, more effective than others? Which programs are right for our cultural context, for the needs of our population? And what are the trade-offs that we need to make when we use an evidence-based parenting program, but find that it needs to be modified or that we're transitioning that program to scale? And the truth and the reality is that we're all familiar with is there's no one size that fits all. Parenting programs have been designed to achieve different goals. For example, a program may be designed to prevent violence against children as its primary goal. It might be designed to reduce parental stress, or it might be designed with a specific delivery modality in mind, such as home visits, or for specific populations, whether that's children at risk from malnutrition, those with developmental delays and disabilities, or those growing up in adverse humanitarian response settings. Given that diversity, it's not at all surprising that we see some heterogeneity in the impacts of programs. But even when we're looking at similar programs that might be drawn from the same original developers, we find that some programs achieve greater impacts than others. And this in part might be explained by what we're describing as the common elements. These are the ingredients or the catalysts that drive successful program outcomes, these benefits that we want for our parents and for our children. And if we know what these common elements are, we can improve the efficiency of delivery of programs, and we can support how well they are transferred from one setting to another. And when we say common elements, we're really talking about implementation factors, such as dosage and quality, or how training is provided in programs. We're talking about theories of change, and we're talking about behavior change techniques. So how is it that we're implementing these programs? Is it by the use of videos? Is it with problem solving? Are we doing peer-to-peer support? One of the challenges that I've encountered is we often don't know much about these factors. Which one of these factors or mix of these factors really drive the program benefits? And that's because when we look at the reports or evaluations of parenting programs, and this is what we've illustrated on the right-hand side of this slide, is that there isn't much reporting of the things that we really need information about, such as the training modality or how supervision was organized, or even the cost of programs. And that's what we want to address. So we have 4 aims. The first is to identify the common elements in evidence-based programs that are intended to support children in early and middle childhood. And for GISP, really, this is the start of a process. As Shakufe mentioned at the start, we want this to continue eventually into adolescence as well. We also want to then describe these common elements. What are the common elements that we find in programs for a specific age group or for a specific population or type of modality? And how can we distinguish which common elements we see in more effective or less effective programs? Thirdly, we want to understand the associations of common elements with respect to primary and secondary outcomes. What are the common elements that are absolutely critical if our primary goal is to reduce maternal depression, for example? And finally, we want to, and our most important goal is to make this information accessible so that everyone who is involved in implementing programs, creating or adapting programs will have the information they need about the common elements that are right for their communities. So how are we going to do this? Our intention is to not rely on what is published in the evaluations by themselves, but to go back to the original source, that is, identify common elements from curriculums and materials that are shared with us by the developers of parenting programs and by principal investigators that have been involved in this work. We're adopting a method that's been developed by Chopitra and colleagues, which is a systematic process for then distilling those common elements and matching them, grouping them to program goals for parenting and implementation settings. So where are we in the project so far? There are 2 phases, and we have very recently completed the foundation setting of this project in phase 1. We conducted an umbrella review, and that is, we reviewed all of the reviews of parenting programs we could get hold of that's published in the peer-reviewed literature and in the WHO database. And we did this because we're really interested in understanding the different typologies of parenting programs, those that are targeting different populations or have different goals in mind. What are their impacts? Where are they implemented? And which ones happen to be more successful than others? Once we've identified these reviews, from them, we took out all of the individual unique parenting programs. And using these, we are going to start work in phase 2 in the coming weeks. Here in phase 2, from each of those individual programs, our goal is to use the curriculums, use the materials provided to us, and identify or extract those common elements, those implementation factors, theories of change, and behavior change techniques. We want to organize these in groups or patterns that help us explain what profiles are more prominent in successful programs, for example, for home visiting, or successful programs for group-based parenting for children and caregivers in the period of middle childhood. Once we do this, we want to assess how those common elements impact children's development outcomes and the parenting outcomes that we care about. What are the goals that we care about in our programs, and how are these impacted by the common elements we use and implement? And the most important outcome of this work is a public good website. As Shikufe highlighted, we want to be able to create a parenting program database. This will be a summary of all of the parenting programs we've identified, a summary of what these programs are about. We want to be able to categorize them to say this program is particularly important if your parenting goal is to reduce violence against children, or to promote school readiness, or to support responsive caregiving. And we want to provide information about which common elements are absolutely critical, so that if you're creating a program or if you're adapting a program, you don't lose those essential ingredients. So why is this important? It's important for implementers to be able to navigate this landscape and identify the right program for their needs, or to figure out how to create the right program for their needs. It's important for the evidence based on parenting to not be behind closed doors. We want to be able to share this transparently so that people can make the right choices and understand the trade-offs when making the choices that have to really be a balance between your ideal and the pragmatic realities. And finally, we want to be able to encourage the accessibility of curriculums. Where can you find curriculums? Who do you reach out to? And this process is going to be supported, or is being supported rather, by a global group of technical experts in our technical advisory group. These are people that have rich expertise in different types of parenting programs. And this will ensure that the evidence is transparent. It isn't biased towards any particular program or any particular organization. It's really trying to be universally global good. We will also have a wider stakeholder advisory group. And if you're interested in joining that group and learning about our progress and also providing input on how we can make it more useful for those of you at the cutting edge of implementation, please reach out to us so that you can be connected to this group. So, what have we learned from this very early phase? As I said, our first phase was to identify the parenting programs that have an evidence base behind them. And we started by screening close to 3,000 reviews on parenting that have been published around the world or that are in the WHO databases. And from this, we found 38 systematic reviews that were about parenting programs implemented for children in the first 10 years of life, covering early childhood and middle childhood. And from this, we found 736 uniquely evaluated programs. And while this is still undergoing detailed analysis, we wanted to provide you a small taster. So first of all, what is not a big surprise is that while most of these parenting reviews were global in nature, they still tended to focus on high income or upper middle income settings. The majority of these parenting programs focused on the early childhood period. And so when we think about transitions in the life course, we have to pay more attention to what happens when children cross from 6, 7, 8 years of age into that middle childhood, and how do we support them? And the majority of these parenting programs were really focused on targeting particular risks, such as children at risk of malnutrition, or those that were growing up in complex adversity. And the top 3 primary goals that these parenting programs targeted was the reduction of behavioral problems in young children, the support of caregiver mental health, and then the support of child development and learning. I'll now hand over to my colleague Janita, who will share a little bit about some of the impacts that we see of these different typologies of parenting program goals.
Thank you, Prof. Hi, everyone. I am very excited to be sharing some of our preliminary findings from our meta-analyses, as shown by the forest plots on the right-hand side of the slide. So each row in the study is each row in this plot is a study with a square representing the effect size, and then the line through it showing how uncertain or certain the results are, so how much they could vary by. If the square and the horizontal line touch or cross the center line, the study doesn't show a clear result. And if the square and the line don't touch that center line or the zero line, that's running through it vertically, the study is providing sufficient evidence, or what we would say in the research world, statistically significant results. And then the diamond at the bottom in these plots summarizes the overall results and their uncertainty. So here for cognition, we're observing small to moderate benefits of parenting programs. And here the diamond at the bottom is to the right of the center line, so it's statistically significant. However, for stimulation, Prof, you can go to the next one. For stimulation, we're also seeing small to moderate benefits of parenting programs, but there's few studies that look at stimulation, which is a missed opportunity in these reviews. So in phase 2 of this work, we are hoping to identify the common elements of intervention curricula that may be associated with the most impactful programs for these outcomes. Similarly, we observe small to moderate benefits on caregiver-child interactions. Here, the diamond is to the right of the center line. However, there is a lot of variation in how this is measured. And again, in the upcoming work, we hope to dig deeper into what common elements of curricula are associated with responsive caregiving actions. Similarly, we find small to moderate benefits on reducing violence against children. Here, the diamond in the graph is to the left of the center line, and this is good because this is a negative outcome. So our aim here would be to identify the common elements of curricula that could be supporting caregiver-child interactions and positive relationships, and thereby reducing violence against children. For disruptive child behavior, many reviews looked at this as an outcome or as the primary outcome. And we observed that parenting programs had a small reduction in child disruptive behavior. Here, the diamond is to the left of that center line. However, all this evidence is primarily concentrated in high-income countries and tend to focus on the preschool age using branded packages. So in phase 2, we hope to identify the common elements of parenting intervention curricula that would matter if we were able to transport these programs to resource constrained settings. And then finally, we do not observe evidence that parenting programs reduce parenting stress. The diamond here crosses that center line, showing that there's uncertainty in how this is measured. So to reiterate our phase 2 aims, we would want to identify which common elements of parenting programs may be effective in reducing parenting stress.
Thank you, Janita.
Thank you.
As you can see, most of these parenting programs that we saw in these reviews, which encompass data from more than 700 programs, generally show that the impacts that we hope to see on children's outcomes and on parenting outcomes are quite low. So the question is that we want to address in phase 2 is how can we improve that? How can we figure out what we can really push in these programs that can drive those implementation factors so that we have more beneficial impacts on children and on parents? So as we continue with the analysis and we continue to unpack why we're seeing those common elements that are why we're seeing those low impacts, we want to be able to broaden the work out by inviting you to join us and help us to understand the drivers of program successes. And we will want to do this by asking for your collaboration. We invite you to join us by sharing your curricula. And we want to highlight here that we are not critiquing individual program effectiveness. We're really identifying what are the common elements across programs and searching for patterns that inform how programs can improve. In other words, this analysis is at the aggregate level. As you've seen from the data that Janita presented, It's not enough to know the impacts of those programs. We want to go deeper and identify from the curriculums that you share those common elements and see how they're associated with programs that are more impactful or for programs that have no impact whatsoever. And we'll do this, as I explained, by distilling those common elements from across programs and matching them with program goals, settings, and population risk. And then we want to be able to share this on a public good website, as I've described, which will include the summary data on the parenting database about what programs are available, and with permission, share summaries about programs, for example, what their goal is, who they're targeting, where they've been implemented, what is the nature of the intervention? Is it a home visiting program? Is it a clinic-based program? And how you can access or contact the developer to find the curriculum. We'll also share information about the different typologies of effectiveness of parenting programs and the information about the common element profiles that are behind those program successes. So if you are interested and would like to learn more or share your program information with us, you can submit this information at this website link. And if you want to reach out and learn more about the program and the emerging data, I'd be very happy to chat with you all. And my email is here. So I'll stop and I'm happy to take questions.
Thanks, Aisha. So colleagues, if you have questions, you can either raise your hand and we'll unmute you or put it in the Q&A and we'll look at it there. Aisha, there's a question for you in the chat if you want to look at it.
Okay. Yes, so we've only been able to, in this short time, provide a very small snapshot of the parenting outcomes that we're looking at. So in Patricia's question, she asked whether we would be measuring things other than parenting stress, and that's definitely the case. We have data on anxiety, we have data on depression, and we also have the promotion of well-being, efficacy of parenting, confidence in parenting. And just two things that we'll highlight from this very early work. First of all, unfortunately, we are not seeing consistent benefits or any benefits really of parenting programs that are significant on reducing poor mental health in parenting. That's not to say that there aren't individual program successes, which is why the work is really important for us to figure out what are the common elements in those successful programs that we should be learning from. And there are very, very few programs that are actually measuring things that might be important to us, like efficacy that parents have in parenting and confidence. So these are also important lessons that we want to be able to share.
Thank you, Aisha. I see we also have a question from Afia. If you would like to unmute yourself and share your question, please.
Yes. So my question is, how are there any collaborations with behavioral analysts that have taken the role of understanding the increase of violence against children and how that can be reduced in programs? So are there any collaborations with like ABAs that would help understand why there's an increase in violence against children, impacting the reduction in programs that are supporting children who are violent? So understanding the behaviors for a social significant change.
That is a really important aspect of the work that we're doing. And as I mentioned, we have a technical advisory group, and those global experts all have different expertise. So some come from the field of working with children with developmental delays and disabilities. Others have more richer experience in working in violence prevention programs with young children and children in the adolescent and middle childhood period. And others work more in the relationships between caregivers and young children. So we're drawing on their expertise and trying to dig a little bit deeper to not just to recognize that within a parenting program, there's only so much a parenting program by itself can do. And so are there parenting programs that do a better job of navigating the systems around the child, the systems of care? And perhaps those are the common elements we should be drawing on to learn about that pathway to helping us get a further reduction in violence against children. So this is, as I said, the very early stages, but we're hoping to build on and these important issues. So please keep sharing those questions so that they are not missed in how we eventually disseminate the evidence.
Thank you so much.
Thanks, Aisha. Sorry, 1 second. So there's a really important question where Catherine Scott says, really exciting to hear about this. What plans do you have for making sure that all relevant policymakers and implementers know about the website? So Aisha, you can respond, but also Sabine is online, who is a partner in the Global Initiative to Support Parents, and there's an important conference coming up as well, so she can also share. And then we need to close up the Q&A. And Aisha, there's one more question for you about, can you share more about the delivery agent type of frontline work aspect of the common elements? Do we know anything so far? So just those two questions, and then we close up the Q&A. So first, the policymaker dissemination question, and then second is on the delivery agent.
So maybe I'll briefly just touch on the delivery agent first and then hand over to Sabine to elaborate a bit more on how we're reaching out to a wider audience to make sure this isn't something that stays within an academic community but reaches practitioners and policymakers and foundations. So in terms of the delivery agent, what we've learned from previous reviews is that there's a whole breadth of the ways programs have been evaluated, where there's been a lot more researcher or expert level of response support to delivery agents. And what we want to understand is a lot more about the common elements, not just the common elements where we deliver to the parents, but the common elements that are behind good supervision, the common elements that are behind good training. So if we can come up with an optimal mix of common elements to say, these are the absolute minimum essential ingredients you need to train a community health worker or a primary care nurse or a teacher to support a parenting program, that's the kind of evidence summary that we eventually want to be able to disseminate. Sabine, I'll hand over to you to talk about the broader connections.
Thank you very much, Aisha. And first of all, I want to just hugely congratulate you. I mean, what a phenomenal piece of work. And I just want to also thank Shekufe and GISP for leading on this, because I really think this is going to shift the needle for parent and caregiver support. It's going to make it accessible, it's going to make it understandable and evidence-based. And we can really use these common elements to bring parenting support to scale. How are we going to disseminate it? I mean, you're working with the biggest agencies between the 5 hosting agencies and all the others that are involved in the Global Initiative to Support Parenting. I always think that good things go around like hot fire, and I think this will definitely be one of them. So I'm pretty confident about that. In addition, we have the Ministerial Conference on Ending Violence Against Children on the 7th and 8th of November. One of the key breakthrough areas is parent to caregiver support. We're expecting many pledges around parenting support. So from Switzerland to Swaziland, it will be really useful for them to have these common elements at hand as they develop their ideas around implementing the pledges around parent and caregiver support. Over to you, Shekufe.
Amazing. Thank you so much, Sabine. And so I see that a lot of questions are coming in and they're all really important. Sarah Klaus, I've allowed you to speak. I think you have a really good question if you can articulate it live. And then Aisha and team, if you can spend some time in the Q&A just answering people's questions. And colleagues, you can look at their responses in the Q&A as well. So Sarah, Klaus, over to you, and then we close out, and then back to you, Claire.
Hi, hello. I'll just read my question very quickly. And again, just to reiterate.
Sarah, if you can introduce yourself as well.
Oh, sorry. I'm Sarah Klaus. I'm in London, and I am a consultant to One Sky and also an adjunct at Georgetown University Center for Child and Human Development. And I wanted to add to the congratulations for this wonderful, very, very needed work. It's very positive and humbling to see the small, moderate benefits in a number of areas. I was also curious if you'll also identify some outliers or programs that have particularly high or low impact and which might show us where there may be some potential to maximize impact. That would be really interesting. I was sort of impressed by the impacts of parenting programs, but sometimes wished that the needle had been just a tiny bit higher in some cases. So I wondered if you could comment on that.
Yeah, so that's really part of what we're going to be doing in the next phase. So right now, we've just said, here are the average impacts. But once we have the common elements, we really want to draw out which are the common elements that we see more frequently in high impact programs, medium impact programs, low impact programs, and also importantly, Sarah, the programs that haven't been successful, because I think that it's part of a learning for us as a community to understand what hasn't worked so that we don't reproduce that cycle as well. So that's certainly critical for us, and setting realistic thresholds and realistic expectations of what to expect from a parenting program in different contexts of risks. So thank you.
Thank you so much, Dr. Aisha. It's an absolute pleasure to learn more about this important project and to also hear the conversation, questions coming from the global parenting support community. So thank you so much. And so we're going to move on now to the next important item on the program for today. And as many of you will know, that we are hosting, well, WHO and UNICEF are hosting the Global Ministerial Conference on Ending Violence Against Children. And this will be taking place in Bogota, Colombia in November. And we have with us today Helen Morton from the WHO to take us through the latest news and preparations for this landmark event. Just to flag before I hand over to her that there is a social media toolkit that has been released by the WHO for open use. And this is to support your advocacy to end violence against children. So please take a look at the GISP website at the Resource Hub, and you will find the toolkit there available for your download and use. But now let me hand over to Helen. Thank you so much for taking the time out to join us, Helen.
Thank you so much, Claire. And really, the thanks go beyond having us join this call. I think all of us at WHO, I see Sabine, my dear colleague and friend, is on the line, but we're so thankful to the work of GISP and all of the partners on this call in terms of your leadership and your partnership around this agenda. And I think there is the potential for a kind of truly historic and momentous moment on ending violence against children, and it's less than 50 days away. So that is certainly something that is focusing our hearts and minds, and we're really keen to explore what we can do with you in these final few weeks to make sure that we really maximise the impact of this ministerial with and for children. Next slide, please, Claire. So we always start with the essential information, but before doing that, in most conversations we have around ending violence against children, we really try and centre everyone in that conversation on what this really means and why it really matters. You will know, because many of you work both with parents and with children, that when we talk about violence against children, we're talking about a 3-year-old who is being slapped in the face. We're talking about a teenager who potentially has been abused by a coach. We're talking about a young person who might be facing intimate partner violence. We're talking about a child who might be afraid to be on the streets in the evening, and certainly that sometimes in the home, at school, online are places where children don't feel safe. And that's something that we really want to anchor right at the heart of the ministerial conference, and that all those ministers and others attending are clear why they're there and why there's such significant emphasis on trying to have this be a moment that matters. Many of you will be familiar with this essential information. You'll know that this first ever Global Ministerial Conference on Violence Against Children is taking place in Bogota, Colombia, and that it's taking place on the 7th and 8th of November. They are the 2 conference days proper. There are 3 preceding days, and I'll speak to those on a subsequent slide. But the ministerial conference itself, whilst it has been a collective effort across hundreds of different organisations, children, young people, survivors, academics, philanthropics, diplomacy, celebrity, civil society, all coming together behind this moment. The conference co-hosts are 5 entities. That's the Government of Colombia, the Government of Sweden, the World Health Organization, UNICEF, and then the UN Secretary General Special Representative on Ending Violence Against Children. In terms of invitees, we originally intended for this to be a meeting that brought together member states and ministers and key non-government actors. We have been absolutely encouraged and overwhelmed, frankly, by the response we've had. As it stands at the moment, we have 120 governments registered to participate in the ministerial conference, and more than 80 ministers registered to attend. And something that was really important to us is that whilst we're the World Health Organization, this isn't just a space in which we hope and expect individuals with a health portfolio to come together. We absolutely realise on this issue above all others, it's going to require a multi-sectoral response. So we're really delighted that the ministers attending and the delegations attending span everything from health to justice to social development. And that feels like a significant step forward for us. Non-governmental actors and allies, we were also inundated, again, very strong appetite to participate and be part of this moment. So we expect in total that there will be over 1,000 people in Bogota for this ministerial event, and therefore we want to ensure that every one of those 1,000 people is able to gain something and contribute something from being in Bogota over the course of those couple of days. Next slide, please. So undoubtedly, the ministerial conference will deliver many and various things, but we have 5 specific outcomes that we bear in mind. The first is that we absolutely want to see new ambitious commitments to preventing and ending violence against children. We'll talk a little bit about that later in the slide deck, but this is really what ultimate success looks like. This is not a talking shop. This is not just a space for sharing progress and pitfalls. There is an expectation that all governments attending the ministerial conference attend with a concrete, additional and ambitious announcement of action. So that really is our kind of watermark in terms of what success looks like. Likewise, the ministerial conference will see a relaunch of a member state-led initiative on ending violence against children. Many of you will be familiar with the Pathfinders initiative that brings together close to 40 governments who self-select to be leaders on the issue of ending violence against children. So we shall see a relaunch of that initiative in November. And equally excitingly, if not more so, there's also going to be a launch of a first ever truly globally child and youth-led movement on violence prevention. And actually this year, there have just been some phenomenal efforts by children and young people and also survivors to try and have their voices be centred in these conversations. And we work hard as co-hosts to make sure that space is afforded to those individuals and those initiatives to make sure that that's kind of tonally and positionally part of the offering of the ministerial. There will also be an intergovernmentally consulted outcome document or political declaration. Governments are coming together to begin to negotiate that in Geneva from the 8th of October. So expect to see a couple of rounds of negotiations there where all member states are invited to offer their sentiments. And as I said earlier, for us, there is a particular outcome around providing a platform for public survivors to share their perspective, to share their priorities. That to us is a clear win, and we want to make sure that that is out there as one of the big objectives. Hopefully you get a sense that tonally we want this to be different. As a ministerial, we're committed to it being ambitious, impactful and inclusive. And we've put numerous efforts in place these last 6 to 9 months to try and have that be the case. So count on us to try and deliver against that objective. We won't touch on this in any detail, and apologies, the slides seem to have formatted a little bit unusually, but as I said earlier, the conference itself is two days. Oh, I think I've lost you.
Helen, are you there? Can you? Yes, we can hear you and see you.
Sorry, I lost you slightly there. I'm not sure what happened, but the conference itself is 2 days, and then there are 3 preceding days where we have a whole host of satellite events. This is not a comprehensive list, but hopefully gives you a sense of some of the actors that are working in partnership and some of the thematics where we'll be doing deep dive sessions. So they will be the 3 days preceding the ministerial conference, which lasts for 2 days. If you're interested, and sorry, my line just cut, but if you're interested to get a more detail on the program itself, just check the official conference website, and the program is there. You can get a sense of kind of the flow, the areas that are being prioritised. Perhaps useful to know that all ministers that are attending will be given a plenary slot to make their announcement of action, and all sessions in plenary will have either a child, youth, civil society or survivor representative as part of the panel makeup, either a moderator or speaker. Next slide, please. Wanted to give you a sense of some of the work we've been doing to prepare for success. This is just one moment in time. This is 2 days coming together in Bogota. The real work and the real success, frankly, comes from the work we do before and the work we do afterwards. And I think the slides are flipping. But just to give you a sense of some of the pathways and some of the groups that we've really been actively working with. So with donors, we've been doing a fairly intensive effort to try and bring together both donors that are active in this space, but those that are active in key intersections, whether that be violence against women and girls, mental health, education. That's been a really critical link for us. With civil society, every month we have town hall meetings that bring together hundreds of individuals from around the world to both learn and listen, but also contribute and share the work they've been doing. Likewise with media, we've been working solidly on op-eds and open letters and blog posts and similarly. And we mentioned already kind of the work to engage young people and children. High-profile champions have been a core ally of ours and a core focus moving forward. We just have come out of UNGA, where there was a very high-level dinner, which we're really delighted to host under the auspices of WHO Director General Tedros, which brought together heads of state, celebrities, heads of UN agencies, government representatives, survivors and young people. So all that to say, we are trying to work every single channel and every single lever to apply maximum pressure around this ministerial moment. And when I say maximum pressure, what we're really looking to do is increase the level and likelihood of commitments to children affected by violence. So that is really our task for the next 50 days. Next slide, please. I won't touch on any detail on this, but one of the ways we've been working hard to make sure that those government commitments come to bear is that in over 60 countries, we have been supporting national preparatory sessions. And the focus of those have been to have a capital level conversation across government to capture what their story of success or progress has been, agree on what a new substantive commitment is that could be announced in Colombia, and start to think about how they potentially could engage with this Pathfinder 2.0. Next slide, please. So we have less than 50 days to the ministerial. Wanted to give you a little bit of a signposting in terms of where you might be able to make a difference. If your government is not registered to attend, and I can put the latest list in the chat in a moment, if your government isn't registered to attend the ministerial conference, now is your time in these final 50 days to make a compelling case for them to attend. You can do that publicly, through media, through hustings, whatever it may be, or you can do it covertly. You can do it individually, or you can do it collectively with peers at country level. Please encourage them to be present and to be kind of actively engaging with this moment. They will be in the minority if they don't attend. So we have 120 governments registered to attend. So if your government isn't registered to attend, see if there's anything you can do to have them feel some of that positive pressure to share their story of progress and come to the table and commit. In many instances, your government might be, oh, sorry, if you can skip back. In many instances, it might be that your government has registered, but your minister hasn't. There's a really strong opportunity there. So 80 governments have registered ministers. But just let them know that there is funding available for one minister to attend from low-income countries, and that all ministers that are attending will have their moment in the spotlight. They will have an opportunity in plenary to make their commitments, to make their announcements on ending violence against children heard. And if your government and your minister are registered to attend, this is where the rubber hits the road. They shouldn't be coming to Colombia just to be present and just to kind of wave and smile. They need to be coming to Colombia with a concrete commitment of action. Please work with your governments. Please encourage them to be putting in place new, additional, ambitious announcements. In an ideal world, they would be costed and they would be timelined. But we recognise in some instances that isn't possible. If you do face pushback on things like fiscal space and competing budgets, think about other commitments that your government could put in place, which could be impactful, but not necessarily requiring massive investment. Corporal punishment legislation is a really critical example of that. If your government hasn't already put that legislation in place, are they close to? Could this be a moment where they could announce their intent to do something like that? Obviously doesn't have as significant a funding requirement with it. And just to repeat Sabine's point, the conference has 3 big thematic breakthroughs that we're looking to push around parenting, around safe space in and through schools, and around response services. So certainly for anyone on this call today, the ministerial itself is trying to create political space for commitments around parenting. So please do see us as your allies and see that as a space that you might like to leverage. I think we're at time, Claire, so I'll maybe stop there. We possibly don't need to share that slide, which is just some example pledges. Thanks so much.
Thank you so much, Helen. It's really a momentous moment for the globe. And thank you to you and Sabine for all the effort that you are making to bring it to the globe and to change the way that, that children are treated and to end violence against children. So thank you for sharing that with us today. And if I can invite the registrants today or participants today to please post any questions in the chat box, and perhaps Helen and Sabine, you can answer there. If you can just scroll through and have a look just in the interests of time. But thank you once again for joining us. And also just to add, once again, the social media toolkit is available for download on the GISP website. And GISP will also be hosting a side and satellite event at the Inter-Ministerial, and this will obviously be focusing on the breakthrough of parenting as it relates to ending violence against children. So please do keep tuned for that, and we will be sharing more information as we go. Thank you so much, Helen. And now we're going to move to Karen, who is from the Mikhulu Trust, and she will be sharing some information on the book sharing project that she and her team have been implementing with fathers. And why do we have Karen here today? Well, September, we are featuring as GISP the theme of parenting and storytelling. And this is in commemoration of International Literacy Day, which is observed on the 8th of September each year. And storytelling is a wonderful device to share knowledge, invite curiosity, and build relationships. Parents and caregivers are often children's first and most imaginative storytellers. And to share more about this book sharing project, I'll hand over to Karen. Her brief bio is up on the screen there. I won't read it out. I'll just stop screen sharing and hand over to you. Thanks so much, Karen, for joining us today.
Thanks so much. And hi, everybody. We're really excited to be sharing some of our work with you. But sharing, okay.
It is in preparation mode, not in presentation mode, but yes, we can see it.
Thank you. There we go. So thanks very much for inviting us to share our work with you today. We're going to be talking about the Book Sharing for Fathers project that we've done, which is an intervention to promote father-child engagement and also to help reduce risk of violence in both children and fathers. So just a little bit of background about Mikhulu Trust. Our vision is that all parents are supported to develop nurturing and stimulating relationships with their young children. And to do this, we've developed support systems and interventions for parents and caregivers of children aged between the ages of 0 and 6. We build capacity of government and civil society to integrate these interventions into their interactions with parents and families. And then we conduct research on interventions and systems created for parents. So book sharing, which is one of the tools that we have developed, is an interaction between a parent or caregiver and a young child. And it's usually used with a wordless picture book. And I've got a very short video here just to show you what book sharing looks like. So that gave you just a taste of what book sharing looks like. It's an interaction between a parent and child with a wordless picture book. The child has freedom of the book, and the parent is encouraged to follow the child's interest and interact with them around what the child is interested in. Then there are various techniques that are used, things like pointing and naming, linking to the child's experience and the here and now. And all of these are designed to build language acquisition and socio-emotional development. So this came out of research that was done in Khayelitsha, which is an area in Cape Town, a low-income area. And it was tested extensively with in a randomized controlled trial. And the results that came out were impressive. So expressive language and receptive language was increased dramatically through book sharing. It also improved a child's sustained focus. And very interestingly, it allowed children who began at a lower level to catch up with their peers. So there was definitely a step towards education equity there. And in addition, it improved socio-emotional development in the children. But most interestingly, they also looked at how it affected the parents or the caregivers. And there was a marked improvement in parental sensitivity to the child and parental reciprocity. And it's that back and forth that is so crucial in the child's brain development in the early years. And why book sharing is done largely with books with no text is there was research done comparing how parents interacted with their children around a book with text in it and books with no text. And with wordless picture books, the number of questions that were asked back and forth between the parent and the child were far higher than with a book with text in, as well as feedback. And what they found as well is that children's vocabulary increased dramatically with books with no text as opposed to books with text. This was in children who were 27 months old, so they were already talking. And what we've also is important to us is that with book sharing, it can be done by anyone, no matter their education level. So even an illiterate parent or caregiver is able to have a really marked impact on their child's early development. Then we were looking at research around violence, and we know that violent behavior in adolescence and adulthood has its roots in the early childhood, which was true for both high and low middle income countries. And there are three early parenting difficulties which have been found to raise the risk of child aggression and later adult and adolescent violence. And these are unresponsive or insensitive parenting, which can lead to a child being insecurely attached to the parent. Then there's harsh and inconsistent parenting, which leads to child behavior problems, and poor cognitive stimulation and support, which leads to child cognitive problems, such as language delay and attentional problems. And these three adverse early childhood outcomes are significant predictors of persistent child aggression and later violent behavior. So this book sharing intervention successfully targets 3 of the parenting factors, and these have been shown to reduce 3 child risk factors as well. So insecure attachment, behavior problems, and cognitive decrements. Dialogic book sharing, which is what we do, is a brief, simple, and scalable intervention that's been shown in several countries, including South Africa, to reduce both the parenting and early child risk factors for the development of violence. But in South Africa, the program has largely been conducted with mothers, and fathers have an important and unique role in children's early development. And particularly where fathers are, parenting is compromised, it contributes to that intergenerational perpetuation of violence. So what we did is we started looking at how we could use book sharing with fathers and what effect this would have on their relationships with their children. So in 2022, we teamed up with Sonke Gender Justice and the University of Cape Town to measure the impact of dialogic book sharing on fathers' involvement with their children. And one of the first things we did was have focus groups with groups of fathers to see what we needed to do to the program to adapt it and make it more attractive for them to take part in. And what came out of that was that our picture books didn't have enough father figures in them. And so we've since developed a whole lot of books that have positive male role models in them. We adapted the program to be a little bit shorter because we were concerned that fathers wouldn't necessarily be able to sustain the longer program that we were running specifically for caregivers, but which was attended mostly by mothers. We worked with small groups of fathers, so 6 to 10 at a time, and it's 6 sessions over 6 weeks, and each of the sessions takes about an hour and a half. There's supported practice with a facilitator one-on-one. So the child joins in and they practice together, and the facilitator then can help them. And then fathers get the books to take home with them so that they can continue practicing and doing book sharing with their child at home. And over the 6 weeks, we cover building and enriching language, linking, numbers and comparisons, feelings, intentions, perspectives, and relationships. So we're covering both the cognitive and language acquisition as well as theory of mind. Since the study, we've then expanded into working with a number of community-based organizations within the Cape Town area, most of them in violence hotspots. And over this period, we've worked with 417 fathers, and they've been reached exclusively with male facilitators. This was quite important to us because what we realized through the research study was that it brought up a whole lot of other issues that fathers might have around their own experience of being fathered, and also the ideas of masculinity and what that meant. And that we weren't equipped to deal with this. So we partnered with community-based organizations that had that skill and were already working with groups of men. Some of the challenges that they faced was book sharing topics triggered other concerns that they wanted to talk about. So how they were fathered, the impact that this had on their lives, and how they perceived their roles as fathers as a consequence of this. And then also not being allowed access to their children, either by the mother or extended family. And the male facilitators were able to hold a safe space for fathers to talk about these issues and for them to come to some resolve around that. Recruitment was also a challenge in certain areas. Fathers were not necessarily open to attending. And we found that community-based organizations that were firmly embedded in their communities had far less trouble recruiting fathers. and that some of the best recruiters were fathers who had already completed the course, which is a good indication for us that they enjoyed the course and they were getting value out of it. And one community-based organization successfully recruited fathers through speaking to the mothers who were at the clinics. For this, we didn't do any major quantitative data collection, but we've done extensive interviews with fathers who've completed the course. And these are some of the stories that they've shared with us. So one father said, on the first day, we learned that how we were disciplined as children is not how we should be doing things now. When my child would do something naughty, I would smack him, just like I was smacked as a child. The young man that is educated, has manners, and has money may seem perfect, but for how he solves his problems, that's where the problem is. He's abusive, and not because he wants to be, but because that is the way he was raised. Before I came to the book sharing training, I was raising my children in the same way that I was brought up. And another father, that first book opened up a new world for me and made a whole lot of things possible. My ex-girlfriend feels very proud of me now. Today I can go to her house, just knock on the door and go in. I've access to my child that I didn't have before. I feel so happy and like a new person. Two other stories. The book sharing program changed the kind of person that I was, because even with my wife, I'm not so aggressive anymore. Book sharing didn't only improve the way I was communicating with my children, but also improved things with my wife. In my relationship with her, it made me see myself as a father and not just a husband. I won't lie, it has improved my love life. And in the final a story from a father, when you're spanking your child each time they mess up, what you're saying to them is that every conflict in the world is resolved by violence. Continue speaking to them calmly. Otherwise, we're teaching them that differences are solved by violence. That is what this project has taught us. And that is the end of my presentation. We've got a whole lot more information on our website. So if you'd like to see more of the research that we've conducted on book sharing as a parenting program, please go and have a look at that. And if there are any questions, I'd be happy to answer them. Thank you.
Well, thank you so much, Karen. That was really a wonderful overview of your intervention. We really appreciate you taking the time out to share that. There are some questions in the chat box. If you could answer them there, please, just in the interests of time. But really, thank you so much for sharing. And we're now going to move on to the parenting magazine, which I know many people have been eagerly awaiting. So thank you very much for joining. And this is the virtual launch of the Country Parenting magazine. And it's been a few months in the making. Thank you for the patience that all the countries have displayed in waiting for this launch. The magazine emerged from Parenting Month when a number of countries showed an interest in sharing their stories. And these stories culminated in a publication that shares the voices of those working with parents and caregivers and provides inspiring examples of how resilience and resourcefulness can overcome the challenges posed by conflict, displacement, and economic hardship. Importantly, this publication is a public good, a global good. It was launched in person at UNGA earlier this week. You would have heard that from Shekufe in her introductory comments. And it's now available to everyone in digital format on the GISP website. And I know my colleagues are posting the link in the chat box. Please feel free to read, share, and use it as an advocacy tool to ensure that parents get support when they need it and wherever they are. We'd also like to take this opportunity to thank each country's contribution to this magazine, which really offers a unique perspective on the state of parenting and caregiving support. So our sincere thanks to you all. And I'd like to invite our three panelists who we've invited to join today to share their stories and reflections on parenting support in their country. And we have joining us today, Mohammed Shariful Alam from Bangladesh. We also have Miguel Fontes from Brazil and Fatima Rawat from South Africa. If you can please join us Yes, let's see. All the cameras are coming off. Wonderful. Thank you so much. Thank you so much for joining us and for contributing to the magazine. And I'd like to start, if I may, Sharifel, with you and the experiences of Bangladesh. I know that in your article, you speak about the lack of institutional support for parents and caregivers in Bangladesh. And you say that it's particularly heightened in rural areas. So our question is then, what do you think can be done to change that situation and to advocate for more support to parents and caregivers wherever they are in Bangladesh? If I can hand over to you, please. Can you unmute yourself, please? Sorry, can't hear you. Hannah, are you able to assist, please? Sharifel? No. Perhaps, Hannah, if you could please assist with the sound for Sharifel in the meantime,
Hello?
and I'll move to Miguel. Oh, you there?
Hello?
Great.
Hello?
Thank you.
Okay. Okay, thank you. So first of all, actually, I am very pleased to hear and also be a part of the developing this wonderful evidence by GISP. So before coming to the question, your question, but first of all, I want to say that parenting is very common and exists in all over the world and every community. It is very common, but reality is that is varying from across the cultures and country. In Bangladesh, actually, it is very the parenting system and approach. It is come from the religious perspective and societal perspective, and also it is very common. Is not very common in the Bangladesh all over the countries. So that's why we need to emphasis to make the sense or make the knowledge to the parents about the real parenting situation and parenting knowledge to them what they have left. So in case of Bangladesh, actually, what you asking to me that Bangladesh have a lot of different kinds of policies regarding the early childhood development, not mainly on the focusing on the parenting. In 2013, a comprehensive ECC policy that is developed by the government. It is one of the comprehensive policy for the early childhood development in Bangladesh. And later on, early childhood learning standard that is also developed by the government. And also there is others policies also exist in Bangladesh. But these policies mainly focusing on the early childhood development, not the parenting. So parenting is actually a gap in the mainstream education systems or the policies. So I think there is a scope to lot of work in the parenting mechanism to develop by the government. But other than the government, different organization is working in Bangladesh, national and international organization. They are working in the early childhood development system to develop, and these have their own modality and they have own approach, and this some of have very good approach and modality that can be replicable to the others program. But Educo Bangladesh also have a program in the parenting, the early childhood development program mainly, but it is articulated to the parenting education in this early childhood development program, because we think that actually the gap of the parenting that is mainly comes from the lack of knowledge of the parents and the community. They do not have the enough knowledge about the parenting or the issue, actually the well-being of the children. So that's why we are incorporating the parenting elements in our early childhood development. For example, we engage the community and the parents with our programs, and also develop the contextually meet the parenting modules and the parenting session that has been developed through the consultation with the community, so that their culture and their values and their norms and customs that will be incorporated in the parenting session. So in that process, we also included the others element that is very important for the in case of Bangladesh, especially for the rural and underprivileged community. For example, the malnutrition that is hampered the children development. This kind of facilities actually does not have the community of the poor community. So that's why we have some inbuilt program, inclusive program with the early childhood development, so that parents are know about their elements, about the elements of the how they will treat with the children, how they will deal with the children to develop development of their cognitive or others elements, and also for their well-being. And in this way, we also give the different kinds of facilities and service to the parents, so that they can learn about the parenting issue in their family, and also they can, for example, the food habit and also other hygiene practice that is needed for the children well-being.
So Shariful, just to pause there, if I may, thank you very much for sharing that. And I'd like to come back to a few points that you raised there. I just want to give some time to the other panelists, and we are running short. But thank you for that introduction on the state of parenting within Bangladesh. And what I am hearing is the need really to raise awareness both at parent level as well as at government policymaker level to really propel parenting support forward. But let's hope we have time to come back to some of those points. I'd like to give Miguel from Brazil some opportunity to talk to some of the feature points in his, or in the article representing Brazil. And here you mention in the article pre and post adoption support groups, so important, and yet something not often spoken about within the parenting support community. You talk of how pre and post adoption groups are really promoting responsible parenting. And I'd like to ask you today to share a little bit more about how they go about offering this support to parents. If I can hand to you, please.
Thank you so much, Claire, and thanks for the Global Initiative to support parents. It's an honor to be here. It's interesting because on the parenting and adoption, we have that included in our Constitution, 1988. So it has been over 30 years that parenting has been included in our Constitution. But with the government during this time, the government took much more time with the civil society to structure our health system, unified health system, social protection system, and the education system. So it took a lot of effort from the social society to really dig into these policies and contribute to new innovations in parenting support, especially adoption. So, for example, we have a National Association for Adoption Support Groups with over 200 organizations. So it's a big network that provides support to the social protection system in a way to invite adoption parents, same-sex or heterosexual, single parent, all kinds of adoption parents, to these support groups at the municipal level, at the local level, at the community level. So these networks has been very strong, and they provide support in incentivizing parents to adopt. At the same time, along the way, helping them with struggles, normal struggles of parenting, but especially struggles related to adoption. But that also includes specific features, for example, for adoption of disabled children. And that's very, very important. And then there is a partnership with various organizations for disability support groups, like, for example, rare disease movements, HIV movement, and so on. So it's very rich in that sense. And what we are celebrating in Brazil, Claire, is that after over 30 years, for the first time, we have a positive parenting policy in Brazil. So positive parenting, and that was signed by the Brazilian government only in March this year. So over 30 years after our constitution, that means that the unified health sector, the social protection sector, and the education sector will have to include all these methodologies and participatory approaches from the civil society now in the structure, in the very structure of these systems in Brazil. So we're celebrating that, and I'm sure this will multiply the effect and will not only be a drop of the water, but will be a major thunderstorm of transformation in support for adoption for disabled children and for children in general.
Thank you so much, Miguel. And it really reinforces the importance of standing up, making sure your voice is heard and advocating for the issues that are close to your heart. And here you're sharing the news of how this has advanced parenting support and led to a policy in Brazil. So thank you very much for sharing that. And now I'd like to hand over to Fatima. Thank you very much for joining us. You are representing one of the two articles from South Africa that can be found in the Parenting magazine. So thank you very much. And I'd like to ask you a little bit more about the role that community and stakeholder engagement play in producing your final product, and how this takes place practically. How do you actually conduct this engagement and make sure that their voices are truly represented in your final product?
Sure. Thank you so much, Claire, and thank you so much for the opportunity. At Sesame Workshop, our mission is to help children grow smarter, stronger, and kinder. And this is realized by engaging with the entire ecosystem of the child. So that means placing the child in the center is at the heart of our efforts, because there's this collaboration that takes place closely with families, communities, stakeholders, and the child to design and implement the impactful programs tailored to the needs of the children and their families. And how we do this is through our rigorous research that we do to ensure impact. So uniting researchers, educators, producers, the thought leaders, we consistently inventing a more engaging, enriching, and encouraging world for children, even as their needs and their environments changed. And these empowering research processes take into consideration the needs and views of children and their families, ensuring that their needs and their views are embedded from inception to production. So we promote an agency view for children and caregivers and communities. Through our needs assessment process, we provide insight into the unique challenges that are faced by communities, and understanding this ensures that interventions are contextually responsive. So this engagement with local community stakeholders, thought leaders, ensures that whatever content that we produce for our interventions are culturally relevant and they aligned with specific needs, values, and practices of the children and families that we serve. So the main thing is this collaboration and providing this and promoting this agency view of caregivers and children as well.
Thank you so much for sharing that, Fatima. And what I'm really taking away from that is that ultimately the beneficiaries that we all serve are placed at the center. It's really about recognizing that from the outset and intentionally engaging with them and respecting their views. So thank you for taking us through that process. So we've got, let's say, 2.5 minutes left, and I'd like to do a round of fire for each of our panelists to very briefly say in a couple of words, what would your answer be, please? I'll start with you, Shariful, if I may. What is the vision in Bangladesh for parenting support?
So actually in Bangladesh, there is a need of comprehensive parenting education policies, and there is a gap, and there is a lot of scope to work with the advocacy in Bangladesh government in this list. And Bangladesh government actually have a vision to support the educational system in the mainstreaming the parenting system in the educational system. So there is a scope to advocacy with the government and also to the other different NGOs to capacitate them and how to they engage effectively to develop a comprehensive, inclusive parenting mechanism in our education system, so that the community people and also parents will be supported and by this parenting mechanism. Thank you.
Thank you so much. Miguel, over to you. What is the vision for parenting support in Brazil?
Well, I think there are two policies that are still missing in Brazil that we are working very hard in Congress, because we have the positive parenting policy, but now we are working on the caregiving policy because parents need support. They need caregiving support. So that policy is still being discussed, and we are advocating for that approval. And the second one, the policy on extending paternity leave. In Brazil, fathers have only 5 days of paternity leave, and we are trying to change that to 60 days. So I think we're going to get that next year, the two policies, and I think this will be like a three-dimensional support for parents. It's having positive parenting promotion, having a policy on caregiving to support parents, and also have a complete male engagement agenda in Brazilian structural programs like health, education, and social protection.
What a wonderful vision. Thank you for sharing that, Miguel. And Fatima, what is the vision in South Africa for parenting support?
I think the main vision in South Africa is not to underestimate the power of parents as partners in the interventions that we develop, and to empower parents and caregivers, especially in vulnerable communities, so that they can raise healthy, thriving children, and strengthening families and having targeted support for marginalized communities, and looking at promoting gender equality as well, which is a big one, encouraging more male involvement in caregiving. The goal at the end of the day is to ensure that all parents have the resources that they need to support children's development and contribute to long-term social and economic progress, and to ensure that we include parents in all of the development of the interventions and give them the agency.
Agency, that keyword that keeps coming through. Thank you so much, Fatima. And thank you to Miguel and Shariful for joining us. And once again to you and your teams, as well as all the country teams that participated in putting together this inaugural magazine. It is a landmark release. I see there are some questions in the chat about the magazine. Please know that in the interests of time, we will respond on email. But thank you so much for joining us today and for participating in the magazine. I'm going to take one last minute just to share the last slide with respect to some upcoming events on parenting support. Please just bear with me 1 second as I show you some dates. Right, last slide, just to give everybody a sense of what to look forward to in the last few weeks and months of 2024. At the end of October, please diarize. We will be having our October Town Hall, and that will then be followed by the Global Ministerial Conference on Ending Violence Against Children. As we heard earlier today, it will be kicking off on the 6th and 7th of November, with GISP GISP will be holding events on the 6th and 7th, with the actual conference being on the 7th and the 8th. And then we will finish the year with a November Town Hall, and that will close off our series for the year. Please also, just another reminder to complete the survey on GISP. It is open at the moment, and there have been plenty of links shared in the chat box today. Please feel free to go through them and download what you need. Reach out to us if you need anything else or you've got any questions or comments. But enough said. Thank you so much, everybody, for joining. It's been a wonderful town hall, wonderful to engage with everybody. And do go well. We will share the slides and recording, and you can catch up on anything you may have missed. So thank you, everybody, and all the best.